Good morning, everyone. I will today discuss the efficacy and safety of the oral Janus Kinase TreatTech inhibitor Ritlecitinib in adults with active non-segmental vitiligo. These are the results from a phase 2b randomized dose-ranging study with an extension. Vitiligo is an autoimmune disease that is characterized by the pigmentation of the skin. It can profoundly impact quality of life. Treatment options are limited and poorly effective. IL-15, IL-2, interferon gamma, CXCL9, and CXCL10 are all involved in vitiligo pathogenesis. The particularity of Ritlecitinib is that it is selectively targeting JAK3 and TEC kinase. This study was a phase 2b randomized study of Ritlecitinib in patients with active non-segmental vitiligo. The study included a double-blind placebo-controlled 24-week dose-ranging period and a 24-week extension period. We report the primary endpoint, that is the percentage change from baseline in Facial-VASI, and the key secondary endpoint, that is the Facial-VASI 75 at week 24. We also report efficacy endpoint from the extension period up to 48 weeks. Along with the safety finding, the target population were patients between 18 and 65 years old who met the following active non-segmental vitiligo at screening and baseline visit: body surface involvement of 4 to 50%, facial body surface area involvement of 0.25% or greater, at least one active lesion. For the first 24 weeks of dose-ranging period, patients were randomized to one of 5 treatment groups or placebo. 2 groups with Ritlecitinib induction dose for 4 weeks, followed by maintenance dosing of 50 mg daily for 20 weeks. 3 groups with Ritlecitinib dosing for 24 weeks, 50 mg, 30 mg, or 10 mg daily, and matching placebo. For the extension period, we will only focus on those who continue to receive Ritlecitinib. The study was double-blind for both the dose-ranging period and for the extension group receiving Ritlecitinib monotherapy. 364 patients received the treatment, of which 298 completed the dose-ranging period. 187 entered the Ritlecitinib 250 mg group. 158 completed the 250 mg group of extension period. Demographic characteristics for patients in the dose-ranging period were generally comparable across treatment groups in terms of gender, age, race, and central facial VASI. Ritlecitinib 50 mg daily dose with or without an induction met the primary endpoint, that is the percentage change from baseline in facial VASI at week 24. Also, Ritlecitinib 50 mg daily dose with or without an induction also met the key secondary endpoint, that is the proportion of patients achieving facial VASI 75 at week 24. The graph on right shows the time course of percentage change from baseline in central facial VASI. Overall improvement in the mean percentage change from baseline in central facial VASI for all treatment sequences was much larger during the extension period than during the first period from day 1 to week 24. At week 48, patients with Ritlecitinib 50 mg daily dose with or without an induction during the dose-ranging period had a percentage change from baseline in central facial VASI ranging from -60 to -66, and the proportion of central facial VASI 75 ranged from 30 to 37%. Here are photographs of 2 patients. On the left, one patient with skin phototype 2. At day 1, facial VASI was 2.6, and at week 48, it was 0.9, and it doesn't change at week 24. On the right, you have a patient with skin phototype 5. At day 1, the facial VASI was 1.04, and at week 24 it decreased until 0.54, but at week 48 it was decreased until 0.13, which means minus 88% of improvement. This table shows the overall safety profile. Among the 364 subjects evaluable for adverse event, there were 756 adverse events from 277 patients in the dose-ranging period. The proportion of patients with adverse event in each Ritlecitinib treatment group was generally similar to placebo. There were 4 patients with serious adverse events and 11 with severe adverse event in the dose-ranging period. The proportion were similar across treatment group. The number of severe adverse event was not dose-dependent, and there were no deaths in the dose-ranging or extension period. A total of 19 patients discontinued from the study due to the adverse event. The proportion of patients who discontinued due to adverse event was similar across treatment group and was not dose-dependent. The percentage of patients with adverse event, serious adverse event, discontinuation due to adverse event were generally smaller in the extension period than in dose ranging period. Ritlecitinib was effective and well tolerated in patients with vitiligo who received continuous treatment for up to 48 weeks. Ritlecitinib 50 mg daily dose with or without an induction met the primary and key secondary endpoints of the dose ranging period. Patients in the Ritlecitinib 250 mg group of the extension period 24 weeks to 48 weeks showed continued improvement in centrally read facial VASI, locally read facial VASI, locally total VASI, and physician global impression of change up to week 48. And I thank you for your attention.
Thank you, Professor Ezzedine. I think a very important study also to provide data over new drugs. And I think what I find remarkable is that the inclusion had patients with an extension of 4 to 50%. Were there a lot of patients also with this very extensive vitiligo, or do you know that? Because I think it's quite remarkable to include patients who have a very extensive vitiligo, maybe in such an early stage of studying.
I don't know exactly the proportion of patients who were very severe. I mean, more than 20%, I would say. I don't have here the numbers, but I think that the study was international, and probably the patients are always pushing to have a treatment and to participate in clinical trials, especially when they have very severe vitiligo, and we can see it every day, because I know that in my clinic, I have a lot of patients with more than 20% who come and always seek for treatment. They don't want any topical treatment. They are really seeking for oral treatment.
Yeah, I see that Thierry Passeron has a question. He raised his hand.
Yeah, thank you very much. And Khaled, congratulations, very nice presentation and very interesting studies. I have two questions. The first one is, if I well follow, you present a lady with the an involvement of the face and no repigmentation after the first 6 months and after a very nice repigmentation. Do you, is there any seasonal effect, meaning that in the last 6 months was summertime, or what? How do you explain the fact that she was not repigmenting the first 6 months and then repigmenting? This is my first question. And second one, that is, I think, very key, because we are all waiting for oral treatment for widespread vitiligo, but I'm quite disappointed that here and at the ADV, you are just presenting the facial VASI, and we are waiting for the result for the total VASI score. And I would like to have this number. I don't know if you can give us or not, but you just said that there is a tendency to improve, but I would like to know if it's 5% improvement, 10, 25, 50. I think it's really important, because if we are giving oral treatment for our patient, we just don't need to have just the face that is repigmenting.
Yes, thank you, Thierry, for your two questions. For the first question, I do think, I am not sure, but the patient that was presented was having a placebo on the first 6 months or a small dose. I'm not sure. This is to be verified. And for the other results, we will probably give all the results. I don't have the details here, honestly, and I don't know, but I can understand. I think that even for the second period, there is a group who had also, as far as I remember, phototherapy. So there will be the results of all, but it's just that they haven't been analyzed for the moment.
Maybe what is also interesting, that you showed a graph with the improvement over time, and you didn't really see a plateau at a certain moment, because although the improvement was strongest about between week 24 and week 40, and then it appears as if it tends to get a little bit less, and it would be interesting to see how it would go on if you would have a longer follow-up and maybe a longer treatment. Will there be an extension phase beyond 48 weeks? Do you know that?
I don't know, honestly. And you are totally right, Albert. Because we are not seeing this plateau, I think it is very important probably to have a longer period. I know that it's quite difficult to keep your patients in the group for a long period, but because we are not reaching a plateau, it would be very interesting at least to have the results at 72 weeks. This would be of great interest.
I see some questions. Davinder Parsad had a question. Please unmute yourself.
Thank you. Thank you, Khaled, for the excellent presentation. So I just very quick query, like as per your experience, you have used other immunosuppressive agents. So how you place this JAK inhibitor or Ritlecitinib? But in your initial experience, like, are they, something seems to be acting in a better way, or is just, that kind of therapy?
Yes, I understand what you mean. I think that for me, the anti-JAK are anti-inflammatory drug, and I would think that the oral form at least should be used very early in the process of vitiligo, probably before depigmentation of the hands in particular, because we know how difficult it is to repigment hands when it is depigmented. And I don't think this debate is completely closed now. I think it's something that we should all participate in, and I understand your concern. I think that, and Albert pointed truly why those who has 50%, I think in reality, we want to give it to those who are not very extensive at the beginning and who are spreading more than being extensive, to arrest the disease spread and to try to repigment what has been depigmented. But really, I think what is important in the oral anti-JAK is to arrest the disease progression.
You didn't show, by the way, of course, because the VASI of the face is just limited to face and gives the whole depigmentation area of the face. But do you know whether it was possible to stop the spreading, the progression of the vitiligo, which you might expect from a systemic drug, that it would prevent new lesions to appear everywhere on the body? Would be interesting to know.
This is absolutely true. I do think, I'm not sure that the data might be available, and this would be of great interest because the arrest of the disease spreading for me is probably something very important. Of course, the agency, the Food and Drug Administration and the EMA want real results. And for the moment, I guess that one day we will all use the VISAS and try to evaluate very precisely the disease spread, which is of most importance. I agree.
Yeah, maybe even more than just repigmentation, because maybe for repigmentation, we anyway need something to stimulate also the pigment cells, like some UV light, but just really the arrest of the activities. I think a very important outcome, which we don't look much at the studies nowadays, I think.
For the moment, and I hope that we all together will push to do it. And I agree, it's very important. And Nanya is working on it very hardly.
Yeah, I see a question from Samia Esmat. Please unmute yourself.
Yeah. Yes, hello. Thank you, Khaled, for the presentation. I just wondered, is there any results about the duration of the disease? I mean, the response in relation to the duration of the disease or the onset of the disease?
I think we have the duration of the disease in all patients. There was not any, because don't forget that in the trial, as far as I remember, you should have at least one sign of progression. I don't think there is a big difference between those who had a very old disease and those who have a recent disease.
Yes. All right. Thank you.
Okay. So thank you again, Khaled, Ezzedine. This was a great presentation.